Good morning, everyone. My name is Courtney Aguirre. I'm the Program Manager for Public Health and Safety at SCAG. Thank you for joining us for a Toolbox Training on the California Healthy Places Index. We hope that you are staying safe and healthy. As I've said a few times now, if you haven't already, please let us know that you're in the room by typing in the chat feature your name as well as your affiliation, just so that we have a better sense of who's in the audience and we can do better in terms of sharing the materials with you after this training today. Now, on the slide before you, you'll see a handful of housekeeping items. This training is anticipated to take about an hour. When you entered the room, you were muted. If we have heard you since, we'd encourage you to go ahead and mute yourself so that we can reduce the crosstalk. At the end of this training, there will be a questions and answer session. So if you have questions during the presentation, please type them into the chat feature and we'll do our best to monitor and respond to them at the end of the training, or more towards the end of the training, I should say. If you do think of something later, you can feel free to reach out to me. My email address is on the slide, which will be going out to all meeting participants. But you can also reach out to our presenters today. I do think that their contact information is featured in the presentation, and I know that they're both very accessible and easily reachable. And again, we'll be emailing the presentation to everyone who is registered to participate in today's training. So in terms of trying to share my next slide with you, there we go. So this is a quick overview of the agenda for today. Helen Dowling and Bill Sadler are on the line with us from the Public Health Alliance, and they'll be providing today's training. As I mentioned, today's training is on the California Healthy Places Index tool. This is a tool that's designed to help you understand and address your community's public health and health equity needs, which we understand is even more critical for communities today in light of COVID-19. So without further ado, really, I don't want to take up too much time. Bill Sadler and Helen Dowling, who are on the line from the Public Health Alliance, will be leading today's training, and I'm going to hand it off to them.
All right, thanks, Courtney. Can you hear me?
I can hear you, and I can see the
great.
slides as well. So I hope everyone else can, and if you can't, please let us know in the chat.
Awesome. Well, thanks everybody for joining today. I'm Bill Sadler. I'm the Director of Operations at the Public Health Alliance of Southern California, and I have Helen Dowling, our data manager, with me as well. And for those of you who don't know our organization, we're a coalition of local health departments in Southern California. So we have a lot of overlap with the SCAG region. And then we also have Santa Barbara and San Diego in our jurisdiction as well. So it's about 8 health departments, and it's about half of the state's population. And we work with our public health departments on a variety of healthy communities initiatives, including a lot of work with SCAG and the member jurisdictions on transportation initiatives. So on the next slide, I have the same agenda that Courtney just went over. We first wanted to introduce you to the Healthy Places Index if you are not familiar with it. I'm sure many of you are. I know we've done a webinar for the Public Health Working Group, and we've done these in different forums over the past few years. But we did just want to kind of give a refresher and an overview of what the tool is, its key features and functions. And then there's an immediate opportunity to use the tool in the Active Transportation Program application, both to characterize disadvantaged communities. It's a new definition included in the tool this time, as well to be identifying local health concerns, which is a continuation of the last cycle. And then also we'll provide some other use cases where HPI is being used, as well as some new features and functions that we have added and are in the process of adding. So next slide. So at the Alliance, we have a shared value statement, and that's that we believe every Californian should have the opportunity to live a healthy life. However, we know our health is shaped dramatically by community characteristics, like housing, education, economic, and other social factors, which are often themselves shaped through policy. This is the CDC Social Determinants of Health framework, which identifies these broad factors beyond healthcare that impact health. And these determinants are also vary by community. And we're going to show you on the map a few ways that is, but we wanted to create a tool that identified these health disparities, promote policy action, and ensure that the equitable distribution of state and local resources. So our entire approach is rooted in health equity and the social determinants of health. So we asked ourselves, how do we quantify and communicate the impact of community conditions to spur policy action and thus address health inequities? And our response to that was to create the Healthy Places Index, visible on the online map here. We'll return to this map a little bit later, but for now, we wanted to talk a little bit about how we arrived here. So I have the social determinants of health framework back on the screen on the left, and on the right are the Healthy Places Index policy action areas. So these are the groups of indicators that show how closely we aligned our tool with the established view of the social determinants of health. And with this frame established, the development of the index was a multi-year iterative process. We had a steering committee that informed the development of the action areas and our indicators that included local health departments from across the state. We had the state health department participate, the Office of Health Equity within the state health department, and a lot of others that had provided different expertise. So our iterative development process with built-in feedback and beta testing from other sectors, community groups, and advocates greatly helped refine the tool. So some of our best functionality was a result of this outreach and feedback. And so our unique approach compared to other tools, because we know there are a lot of tools out there and that many of you use for different things that include health data, we really see it as a three-pronged unique approach. So the first one is the granularity of the tool. We have data down to the census tract level for all the indicators in HPI and for a lot of the other layers that we have available. And we see that the granularity is really unique in terms of the level that you can get down to, but also that we have a lot of different geographies available. So you can map at the city level or at the county level, or you can use political boundaries like state and federal legislative districts, or administrative boundaries like MPO boundaries, and more. So this is key because unlike under other indicator projects, this fine geographic resolution can reveal the variation within cities, counties, and communities. And then the second way that we see HPI as unique is the link to policy actions. We have a wealth of policy guides tied to each indicator. And one of our selection criteria for our indicators was that it needed to be actionable. And we'll show more about these policy action guides later. And then finally, our index is statistically validated with an important health outcome, and that's life expectancy at birth. So each indicator, as well as the index itself, is linked to life expectancy at birth. And this integrates health impacts over the entire life cycle, so it's broader than any individual health outcome. And we teamed up with the Virginia Commonwealth University's Center on Society and Health to develop the life expectancy at birth data and layer. And we were able, with their expertise, to vet each indicator for its association with life expectancy at birth and develop a final model using an approach that maximizes each policy action area's association with life expectancy at birth and assign weights accordingly. If this sounds Greek to you, don't worry. We'll break it down further when we show the full HPI on the next slide. So the HPI score, which you may be familiar with, is comprised of 25 indicators that represent community conditions at the census tract level and grouped into 8 policy action areas. And they're all tied to the social determinants of health, as we demonstrated earlier. You'll see on the slide as Helen is scrolling through that there are different weights assigned to these and different indicators. And now here you have the full picture of all 25 and the eight groups that they fall into. So you'll see, for example, that economic and education policy action area are more heavily weighted in the tool, and that's because they're more closely correlated with life expectancy, and so they count more when determining the score for a location. So when I discussed our validation with life expectancy on the previous slide, the key takeaway is that every indicator, as well as each policy action area and the HPI in sum, is linked to life expectancy. So this means that by improving any indicator in HPI, so through urban planning programs or health interventions or community projects, we would expect to see an increase in life expectancy. So now that I've provided an overview and you've seen kind of the basis for why we created the tool, I'm going to turn it over to Helen to go through what the tool actually does.
Yeah, thanks, Bill. So I wanted to take a minute and talk a little bit about how we chose to visualize these data on the map. So unlike many other indicator projects, the Healthy Places Index utilizes an asset-based positive frame, and it's present in every aspect of the index in our map tool. That begins with our name, so the Healthy Places Index, and follows to our indicators as well. So we count those above poverty instead of in poverty, for example. We also refer extensively to the healthy community conditions and the health opportunities in a neighborhood, not where it falls short. We also deliberately chose a color scheme that reflects this positive frame. So instead of using reds or oranges, historically associated with redlining or other negative connotations to identify communities with fewer healthy community conditions, instead we used shades of blue. We've built in easy to interpret infographics and accompanying descriptive text that shows you how communities compare to other neighborhoods in California. So let's go ahead and see it in action. Here we selected a tract in Costa Mesa. In this image, this census tract has an HPI score of 15.7. Let's take a moment here to discuss what this means. The overall HPI score, policy action areas, and individual indicators are expressed as percentile rankings. That is, they're relative to each other. An HPI score of 15.7 means that this community has healthier conditions than just 15.7% of other census tracts in California. If this isn't an intuitive concept at first, don't worry. We do include descriptive text throughout the tool that explains in plain language what each measure means. Next, after you've reviewed the overall HPI score, you can take a bird's eye view of the policy action areas and how they contribute to the overall score. The little thumbnail visualizations next to the title of each policy action area are like the HPI score infographic, but in miniature. The position of the black bar indicates that policy action area's ranking. For example, here we can quickly see that transportation has the highest ranking and housing has the lowest, with the others somewhere in between. This can help guide you to the specific policy action areas and indicators or health opportunities that you could focus on for change. You can then click on any policy action area and get a drill down on how each of the individual indicators comes into play. In this case, we've clicked on the economic policy action area. Here, you'll first see that descriptive text I told you about before, explaining this policy action area's percentile rank. You can also see all of the indicators contained within the economic policy action area. In this case, we have above poverty, employed, and median household income. The numbers and visualizations to the right of each indicator are again their percentile rank, so how this tract is doing on each indicator compared to all California census tracts. I want to point out that this doesn't show the population proportion of those above poverty, for example, but I'll point out where you can get that information in a moment. So taking these three indicators together, we can see that the above poverty indicator has a low percentile rank, yet the employed indicator has a much higher percentile rank, approaching the top quartile. Seeing these indicators together is important in terms of thinking about the types of actions that are needed. In this community, we can see that people are working, yet they don't have living wages. You can go further and click on any individual indicator and get a full-size infographic, explanatory text, and for those who are interested in getting this indicator's value, so that is in this tract, you'll see that in our what does this indicator measure section that's highlighted here. If you scroll further, We've provided clear information on how this indicator is connected to health and specific policy actions that could improve this indicator. We worked with our communications advisory team and Berkeley Media Studies group to create a values-based and scientifically informed description on the connection to health. For example, the connection to health for above poverty reads, every household should be able to afford the necessities of a healthy life, medical care, healthy food, housing, education, and other basics. Research indicates that economic opportunity is one of the most powerful predictors of health. We've found that these explanations describing the connection to health have been particularly useful as we engage with other sectors. While those of us who work in public health are well steeped in the concept of the social determinants of health, there are many potential users of the HPI, including those in the transportation, planning, healthcare, and other sectors that don't yet have an understanding of these factors. These bridge that gap and help move our data into action. That's why we've also provided possible policy actions for every indicator in the HPI. Here, some potential policy actions are linked to economic opportunity and transportation improvements. If you click on any of the policy action options, like raise wages and benefits, for example, it brings you to a robust policy guide that's located on our website with specific policy recommendations, sample ordinances, links to relevant reports, strategies and plans, templates, resources, and more. Our goal is to thread opportunities for action throughout the tool, from the positive frame and the explicit linkage to life expectancy at birth, to the simple to interpret infographics in our extensive policy guides. That brings me to a breakdown of the full policy guide for this indicator available here. This shows the full list of policy recommendations included under the above poverty indicator alone. The screenshot on the previous slide only showed the first two recommendations under the first column here, so under raise wages and benefits. As you can see, our policy guides are really quite expansive. And what's more is there are 30 extensive guides available across the 8 policy action areas, one for each HPI indicator and a few guides available for some of the climate change decision layers built into the HPI. The guides are accessible directly from the mapping tool and through the healthyplacesindex.org website under the Policy Actions tab. We'll leave a URL for both of these at the end of the presentation. But that's not all. I know that I've already shared a lot, and there's a lot just within the core functionality of the HPI, but we took suggestions from groups like yours to build out additional features and functions to make your work easier. From here, we'll segue into some of the specific tools that will make answering the public health question on the ATP application much easier. With our HPI, you can view data at multiple geographies, not just at census tracts. So this includes cities, school districts, and state and federal legislative districts, among others. We've also built in a broad selection of complementary decision support layers that provide additional local data beyond the Healthy Places Index. These include dozens of health outcomes, which could be useful in characterizing local health concerns for your ATP grant. You can also quickly identify high and low ranked places using the Healthy Places Index or any other indicator of interest, including our decision support layers. For example, you might want to find the census tract with the lowest HPI score in your neighborhood, or the tract with the lowest prevalence of reliable transit access. This could help you prioritize particular neighborhoods or corridors for your application. Most importantly, you can also define custom project areas using our pool function, which allows you to create pools that better match your community, neighborhood, or project area. This will allow you to create an HPI score for the exact area of your proposed project or corridor. Finally, if you have your own internal data sets you'd like to view on the map alongside the Healthy Places Index, we've also built in an upload function. This might be useful for identifying the location of schools in your project area, for example, if you're pursuing a Safe Routes to School program. In the next series of slides, I'm going to demonstrate one of our key use cases here, which is using the HPI for ATP applications. We'll walk through 3 functions that can be used with the applications: ranking, our decision support layers, and the pool feature. But you can also view tutorial videos for every function I just outlined on our website linked here. And I'll leave all of the URLs at the end of the presentation as well. So this is an excerpt from the Cycle 5 ATP guidelines. So it includes Healthy Places Index as an option for characterizing disadvantaged communities. And per the guidelines, it says that a census tract must be in the 25th percentile or less to qualify as a disadvantaged community. So as a note, on our map, census tracts that fall within the 25th percentile are dark blue. So keep that in mind, and we'll see it in action on an example map. All right, so here we've zoomed into central Sacramento. To orient yourself, the black border represents the county outline. You can already see that there are clusters of poor community conditions that stand out from the rest that I've circled here as well as here. So here's a second excerpt from the ATP guidelines. So this is from the Statement of Need and identifying local health concerns. So they need to focus on local public health concerns, health disparities or conditions in the built-in social environment that affect the project community, and using local public health data that demonstrates the above public health concern or health disparity. So the Healthy Places Index provides a couple ways to get at that local health concern issue. I'm going to demonstrate a few ways to get at that now. So we'll go back to that neighborhood I highlighted earlier, and we'll explore the HPI score, policy action areas, and individual indicators for a single census tract. I've clicked on one in the northern part of this cluster of tracts here. It's highlighted in dark blue. Compared to other census tracts in California, it's really not doing well, particularly in economic, education, transportation, as well as neighborhood and healthcare access. These improve life expectancy, so these are the social determinants of health, and because we know that they're linked to life expectancy and thus health, they would qualify as local health concerns. So that's one way to answer that question. But if you're interested in looking at more traditional measures of health to include in your application, you can find these here in our decision support layers. They're separate from the HPI, but can be viewed on the same map. So they're under our View Indicators function. We've grouped our decision support layers by subject, and you can expand each heading to see the layers within by clicking. So health outcomes is your area of interest here. So if you click on that, you'll expand it to see the individual indicators we've included, and say you're interested in looking at the prevalence of diagnosed diabetes in this community, you would click the View on Map button. The map would change, and note in the legend it now says that you're viewing diagnosed diabetes, and that's a quick way to get it. Some more traditional. Next, I wanted to take a minute to demonstrate our rank function. So this is the feature that lets you quickly pull out the highest and lowest ranked geography in a given area. So you might use this to identify or prioritize a particular neighborhood for your project. So to use that, you'll go to the rank function on the left-hand sidebar, and you'll enter a location that you want to rank within. So in this case, we're interested in ranking within Costa Mesa, so you'll type that in and select the city of Costa Mesa. And then the map will rank all of the census tracts within Costa Mesa. By default, it ranks them from lowest HPI score, so most disadvantaged, to least disadvantaged, and it will highlight the lowest tract in dark orange. So you should see that orange outline there. Now, if you are interested in the reverse, so that is ranking it from highest HPI score or least disadvantaged to lowest HPI score or most disadvantaged, you can get at that by clicking the arrows next to the percentile title here. And then it will reverse the ranking, and you'll see the tract within Costa Mesa that has the highest HPI score, also highlighted in orange. And not only can you use this with our HPI score, but you can also use it for our decision support layers, as I mentioned earlier. So for example, if you were looking at diagnosed diabetes and you're looking at a very large area where it might not be obvious where the lowest ranked tract is, you could look at that in a county or in a region, for example, and then quickly find that tract with the highest prevalence of diabetes, for example. So next I want to show you our pool function, and this lets you define your own custom project area and get a recalculated HPI score for that area. So this might be particularly useful if you're working on a project in an unincorporated city, neighborhood, or along a transit or bike corridor, for example. You can simply select those tracks that comprise the project area and get a custom HPI score just for those selected tracks. To do that, you'll go to our pool function in the left-hand sidebar. And then once you click the pool function, it's active, and all you need to do is click on the tracks that you want to add to your pool on the map. So we've clicked on a tract, we're going to add another tract, and you'll see the tracks that are being added in the left-hand sidebar. Okay, so when you're happy with the tracks that you've selected, you'll click the Pool Census Tracks button, and then the HPI score will be recalculated for that group of tracks. And not only does it give you the overall HPI score for these tracks, it also recalculates all of the policy action areas and the individual indicators as well. So you can get an estimate of all kinds of things for this custom set of tracks. And this pool will apply across the whole tool, whether you're using the HPI score or you're using individual indicators. To go back to that diabetes example, you can get an estimate of the diabetes prevalence for just a subset of tracks that are located within your project area or transit corridor, for example. So this is a pretty powerful tool. All right, I think with that, it's been a bit of a whirlwind introduction to all of the different features and functions, but I wanted to bring Bill back to talk a little bit about how else our tool is being used across the state and region.
Thanks, Helen. Yeah, so I know there's a lot to unpack with the different features and functions, but I did want to just briefly highlight ways that people are using HPI. And many of you are probably familiar if you've been applying for different grants from the state. So, you know, ATP is one example of how HPI is being used, but there's several other grant programs where HPI is being used at the state level. First, Caltrans is using it in their Sustainable Transportation Plan adaptations, a way to identify disadvantaged communities. So you can use HPI as a way to, if you have disadvantaged communities, to be eligible for that set aside in that program. And then the Transformative Climate Communities has it as part of their health and I think it's the health and equity benefits question that's more of like a statement of need type, where you're identifying health and the health benefits of a project or health impacts that you're addressing by making a certain type of investment. And then the Community Air Protection Program at the Air Resources Board is also using it. So there's several ways of using it for grants, but then beyond that, there's a lot of different state agencies that are using it for research or assessments, including the State Health Department is using it for nutrition and obesity prevention projects, and their maternal, child, and adolescent health. The Office of Health Equity, Air Resources Board is using it for some research projects. And then planning guidance, there's a lot of planning guidance, as many of you are probably aware, that has integrated health and equity and environmental justice and other similar, and HPI has been integrated into a lot of that guidance, including general plan guidelines, the Senate Bill 1000 guidance for environmental justice elements. It's in a lot of different climate adaptation guidance, the Safeguarding California plan, specifically for transportation. The CDC added it to the regional transportation plan lines and the comprehensive guidelines. There's a lot of different ways that you may come across HPI in your review of different planning guidance you see from the state. And then locally and regionally, similarly, SCAG itself is using HPI as part of the Sustainable Communities Planning Grants. As part of that application, it's already a built-in question in the last round. And then there's a lot of different ways that local health departments and even funders like Kaiser Permanente are using it to be prioritizing investments as well. A lot of different assessments. Those of you who may work with your health departments know that they do community health assessments periodically. And then hospitals do community health needs assessments every few years as well. And so it's been a useful tool for those processes. And then integrating public health, similarly, SCAG has put it as part of its RTP SES. There's different community groups using it. Ventura County has added it to their general plan update. So there's a lot of different ways that HPI is being used at different levels and for making investments. So I'm going to turn it back over to, actually I'm going to do this one and then I'm going to turn it back over to Helen. Wanted to show you one example of a use case for ATP. The Riverside County Health Department developed maps of ATP showing just using the map itself and overlaying it with schools for a safe route school program. This is one way that you can create maps specific to your area and overlay the HPI data with point data or any kind of other type of data you want it to use to show the health impacts of different investments. So now I'm going to turn it over to Helen, and she's going to talk about some of the new features we're adding, including a COVID-19 layer.
Yes, so if you weren't already completely overwhelmed by all of the features and functions and data layers that we include in our Healthy Places Index, I have a lot more to share with you about what we have just launched as well as what's coming down the pipeline. So just about a week and a half ago, we released our COVID-19 HPI resource map, which is also on our HPI platform. It includes a curated selection of it's actually now 50 COVID-19 related indicators. We just launched 2 more late last week. And it also includes our core Healthy Places Index measures to help contextualize the impacts and risk of disease. So our COVID-19 related indicators are organized in 6 categories to help support state and local response to the disease. They include COVID-19 case and death counts, vulnerable populations, health risk factors, healthcare infrastructure, socioeconomic and community conditions, as well as race ethnicity. We also include charts of death rates by race ethnicity for counties that are reporting that information, and that's what that animation on the left-hand side is showing you how to access. So that's accessible by going to our COVID-related indicators, clicking on our county death and death rates by race ethnicity, and then clicking on a county, and you'll get a chart that shows you those death rates by race ethnicity. As far as I know, we're the only organization, the only tool that's collecting this information on death rates by race ethnicity. So it's worth the visit just to take a look at that because it really shows unfortunately, the disparities in death rates across the state. So as this is built on our HPI platform, all of our HPI analysis tools are also available. So that includes ranking and pooling, which I just showed you earlier. These can be used to identify those tracts with the greatest concentration of at-risk populations. So we can go back and use that diabetes example because that also applies here. But we've included additional indicators of interest, such as those living with COPD or seniors living alone or seniors who are linguistically isolated and various other vulnerable populations. And you can use this to get a better estimate of the community conditions, like crowded housing, for example, in your specific neighborhood, project, or service area to really help direct resources and responses to this disease. Here is the full list of indicators that we've included. So as I said, I think when this was published, we had 48. We now have 50. So there are 2 additional indicators that we've just added to our healthcare infrastructure category. Those include the number of skilled nursing facilities per census tract and number of assisted living facilities per census tract. Unsurprisingly, we've focused a fair bit on those populations at greatest risk, which are seniors. So we have 6 indicators specifically describing those elderly populations and skilled nursing facilities as well as assisted living facilities. But we think it's powerful that we also include those measures of socioeconomic and community conditions like adults with health insurance, measures of housing, security, income, poverty, and unemployment, things like pollution. We know that PM 2.5 is associated with more severe COVID-19 health outcomes. So it's about understanding those conditions that might predispose the community to worse outcomes. And before we wrap up, I also wanted to take a minute to share with you some exciting updates and improvements that we're currently making to our platform. So beginning early this summer and continuing through the end of this year, we're going to be rolling out some of these new features. So they include a new and improved user interface that'll make the tool even more intuitive to use. We'll be turning on support for longitudinal data so you can compare indicators over time. For our advanced users to hook directly into our database of indicators, we'll be putting together an API. We'll also have more robust data upload options, including more ways to visualize shape files and point data. So this will make adding your own data to the HPI map even better. We're also working on an expanded export and a brand new sharing function that will allow you to easily download more of our data, so including output from some of our map functions like ranking, as well as share map views with your colleagues. And this is part of many other improvements, small and large, from more color palettes to use on the map to an interactive life expectancy at birth predictor function. If you'd like to be alerted when we launch our updated interface, as well as our new and improved feature set, you're welcome to join our mailing list. I've left the URL for that here, but you're also welcome to email Bill or I directly, and we'll be happy to add you. So thank you again for having us here today. I've left our contact information as well as the URLs for our Healthy Places Index website, which includes our policy action guides, as well as our map at map.healthyplacesindex.org. So we're happy to take your questions now.
So this is Courtney again. If you do have questions, please type them into the chat feature and we can share them with Bill and Helen. For now, I have a couple of questions for you from my perspective. The policy actions that you were highlighting earlier, Bill, are they California specific? The ones that are hyperlinked to?
It's a mix of state and local examples, but there's also a fair amount from other states that are, been implemented elsewhere. So it is a mix. I would say it is a little bit more heavily skewed towards California because we are trying to make it actionable for California, but there are other places where we've integrated. If there was a specific area where there weren't a lot of examples from California, but it was a best practice. So we tried to kind of balance that depending on the issue. Okay.
And then the other question I have is regarding the new features that you have with the COVID-19. Will there be a separate training on that specifically?
So we've been talking internally about that, and if there is interest in it, we may put together a webinar for that. So if that happens, we'll let you know, and then you can distribute out that information to folks.
Okay, got it.
Oh, I do want to mention there's a brief training video. It's less than 5 minutes, but that's available on our healthyplacesindex.org website. There's a banner that links you to more information about our COVID-19 map. So if you just want a quick orientation to the COVID-19 tool, that's a good place to start.
And the data that you have included within it regarding the rates and the numbers for COVID-19 cases and deaths, is that updated every day, or how often is that updated?
Yes, so cumulative cases and cumulative deaths, including the death rates by race ethnicity, are updated every weekday.
Okay, every weekday. Okay, got it. I don't see any other questions coming in via the chat. If you do have questions, please ask them now, since we'll go ahead and consider this our Q&A session, our wrap-up portion. Unless Bill or Helen, you have anything further you'd like to add regarding the tool. I think the tool is enormously fascinating. I could spend, hours really looking at the different data. It's a lot to absorb, I think, as you've both hinted at already.
Yeah, and I just want to mention that if you have questions, if you're exploring the tool and something doesn't quite make sense, or if you'd like some additional guidance, we're always available to answer those questions. You can shoot me an email directly, and I'm happy to get back to you.
Okay. Okay. Well,
And I'll also
mhm.
add too, we're also really interested in collecting use cases. So if you are using HPI in a certain way, we'd love to know about it, so we can add it to our list. As well, if you have questions about the certain way you'd like to use it, certainly let us know.
Mm-hmm. And can you remind me again, because of your, I think your, what is it called, your pooling tool, it sounds as though if we have several cities on the line, if they do want to get data, not just at the census tract level, which is, that granular data I think everyone does want and seek, they can pool their census tracts, right, to get a composite score for their city and
Yes,
other scores for the indicators, right? That would be the best way for them to go about doing this, or a county, for example.
So for all counties and for any incorporated city, as well as any census designated place, we already provide those aggregations. So those are already available. If you log onto the tool, on the legend, we have a button, we call it our geography switcher. By default, it's census tracts. If you click on that census tract button, you'll get a list of all of the other geographies that you can view on the tool, and that includes cities, counties, the state and federal legislative districts, MPOs, etc. Okay. So that would be the first stop, and if your geography isn't represented in that, then you would use the pooling function to create, then you'd use that. Okay.
And so we do have a question from Chris in the chat. You might already see it, but the question is, how do you see this tool being used to develop a guide for reaching out to disadvantaged neighborhoods, especially during this challenging time?
That's a really great question. I think we have primarily built this tool as a response tool, as a place for gathering information for those local organizations and regional organizations who are working on the ground and need the data to help back up their interventions or their projects that they're planning in terms of relief. One thing that I think is really important, and I mentioned this when I introduced the COVID-19 map, but for us, what we're seeing, and you can even see this on our regular Healthy Places Index map, those places that have the lowest HPI scores also tend to have the highest prevalence of chronic conditions, so diabetes, obesity, COPD, high blood pressure, coronary heart disease, etc. And it just so happens that these are also those comorbidities that happen to predispose people to more severe outcomes with COVID-19. So those same communities that have been historically disadvantaged as a result of a lack of investment, intentional or otherwise, they're bearing the brunt of this disease. And you also see this in the death rates by race, ethnicity, which is why we included it, because we wanted to show that this is not, there's been conversation about how COVID-19 is equal opportunity and everybody is at risk of getting severely ill from it. But the fact of the matter is that there are many population groups that are at far greater risk across California, and that's something worth taking a look at. And we think that these data can really be used to help make the case, either as part of the response to COVID or as part of the recovery, that these communities need investments and resources to lift them from this place of disadvantage and improve their health. There's a lot of opportunity there to do that.
Okay. Well, I don't think there are any more questions that have come through. So with that, I think we can conclude, unless anyone wants to chime in right now to let us know if they have additional thoughts or questions. We do want to thank you for participating in today's Toolbox training. The presentation that Helen and Bill shared with you today will be emailed in PDF format to you in the next couple of days. If you do have any questions, you can feel free to reach out to me, but of course, Bill and Helen are the experts, and so we'd highly recommend that you reach out to them first if you do have questions about the tool. And as Helen mentioned, if you'd like to keep tabs on any updates, it would be to HPI, it would be a great idea to sign up to their mailing list so you're aware of any updates and any trainings that they may offer. Bill and Helen, thank you so much for your time this morning, for providing this training. I think the tool is enormously helpful for everyone. I think we've seen a couple of folks chime in the chat feature that they feel this way as well. I want to thank everyone again for joining the training and say that we do hope you stay safe and healthy. Thank you so much.